Hello everyone, welcome back to Mediplaceboo. In this session we will be covering the bones of the hand and its muscular attachments. So the bones of the hands can be classified into three subgroups, which are the carpals, the metacarpals and the phalanges. So here I have presented two images in which we can take a look that we have the carpals, the metacarpals and the phalanges. The carpals are in total 8 bones which are present in the wrist region. Next we have the metacarpals region which are present in this region, that is in the palm region of your hand as well as on the dorsal aspect. Next, within the fingers we have the phalanges. So here we are taking a look at both the palmar and the dorsal aspect of the bones of the hand. So we can take a look at the bones of the hand from both the palmar aspect and the dorsal aspect, or the dorsum of the hand. So the key distinguishing feature for the palmar and the dorsal aspect of the hand is the presence of the pisiform bone. You can notice that the pisiform bone is present only on the palmar aspect of the hand, whereas it is absent on the dorsal aspect of the hand. So if the carpals have the presence of the pisiform bone, we can identify it as the palmar aspect of the hand. Next we have the carpals. In the carpals we have two regions, that is the proximal region which is present closer to the bones of the forearm, and the distal region which is present closer to the metacarpals. So here we have the proximal region. So the proximal region is the one which is closer to the ulna and the radius. Similarly on this aspect. So on the proximal end of the carpal bones we have 4 bones which are scaphoid, which is a boat shaped bone. Next we have the lunate, which is half moon or crescent shaped. Next we have the triquetrum, which has 3 prominent sides and is pyramidal in shape. And lastly we have the pisiform bone, which is only found on the palmar aspect of the hand, which is a P-shaped bone. On the distal aspect of the carpal bones, that is closer to the metacarpals, here are the next 4 bones, which are the trapezium, which is a quadrangular shaped bone. Next we have the trapezoid. The trapezoid is an irregular boot-shaped bone. Next we have the capitate. The capitate is the largest among all carpal bones with a rounded head. And lastly we have the presence of the hamate bone. The hamate is a wedge-shaped bone having an uncinate hamulus, that is, it is a hook-shaped bone at the base. An easy way to remember all the carpal bones is by the famous mnemonic, that is the mnemonic that is, "She looks too pretty, try to catch her." The initials of each word has the presence of the bones from the radial side, that is towards the thumb, to the ulnar side, that is the little finger. So we can take a look that we have the scaphoid, the lunate, the triquetrum, the pisiform, the trapezium, the trapezoid, the capitate and the hamate. To avoid confusion between trapezium and trapezoid, you can always remember that I comes alphabetically prior to O. Next we have the phalanges. The phalanges in total are 14 in number, that is we have 3 on each digit, whereas in case of thumb we only have 2 phalanges, that is we have the proximal phalange and the distal phalange. But in case of second to the 5th digit we have presence of 3 phalanges. It has the distal, the middle and the proximal phalange. So one more point which I want to tell you here is that the trapezium is also known as the greater multangular bone, whereas the trapezoid is also known as the lesser multangular bone. And the thumb in Latin is referred as pollex, and the little finger is referred as the digitium minimi. So when we will be studying the muscle attachment of the thumb and the little finger, it would be easier to distinguish which compartment of muscle belong to which bone. Regarding the metacarpals, it is divided into the 3 parts, that is the head, the shaft and the base. That is, the base is closer to the carpal bones, whereas the head is closer to the phalanges. An important point regarding the head of the metacarpal is that it forms the knuckles, which is present between the phalanges and the metacarpals and are more prominent when we make a fist, that is the metacarpophalangeal joint becomes more prominent. Now let us take a look at the muscular attachments of the bones of the hand. Here we can take a look at the origin and the insertion of the muscles of the hand. The muscles acting on the hand can be divided into two parts, which are the extrinsic muscles and the intrinsic muscles. The extrinsic muscles are forming the pillars of the wrist joint, which we will discuss very soon. The extrinsic muscles are located in the region of the forearm and is responsible for the crude touch, whereas the intrinsic muscles are located in the region of the hand itself and are involved in the fine touch movements of the hand. Now we can classify the intrinsic muscles of the hand in 5 subgroups, which are the thenar group, the hypothenar group, the lumbricals, the intraossei muscles, which can be further divided into the palmar intraossei and the dorsal intraossei, and the other palm muscles. So these are the 5 subcategories of the intrinsic muscles of the hand. Here I am highlighting the group of muscles with different highlighter. Here the subgroup which is highlighted in pink color belongs to the thenar group. The muscles which are highlighted in yellow color belongs to the other muscles of the hand. The green color refers to the hypothenar muscles of the hand. The blue color refers to the lumbricals, and lastly we have the grey color for the intraossei muscle, that are the palmar intraossei and the dorsal intraossei. So here we have the first muscle of the thenar group, which is the Abductor Pollicis brevis. So the Abductor Pollicis brevis will originate from the flexor retinaculum, the lateral part of the scaphoid bone, the trapezium, and would insert on the lateral aspect of the base of the proximal phalanx of the thumb, which can be seen here. Similarly, the Flexor Pollicis brevis also takes its origin from the trapezium and would insert near the Abductor Pollicis brevis. So it can be also termed as the common point of insertion for the Abductor Pollicis brevis and the Flexor Pollicis brevis. Next we have the Opponens Pollicis. The Opponens Pollicis would also originate from the trapezium bone along with the base of the scaphoid, and it would insert on the lateral aspect of the first metacarpal. Now the next muscle group at which we will take a look is the hypothenar muscle group. In the hypothenar muscle group, we have the abductor digiti minimi. The abductor digiti minimi would originate from the pisiform bone, which can be only seen on the palmar aspect or the anterior aspect of the hand, and from the tendon of the flexor carpi ulnaris. Since it is the part of the anterior compartment of the arm, it would have the presence of the flexor muscles, and it would insert on the proximal phalanx of the little finger along with the insertion of the flexor digiti minimi. Here we have the insertion of the abductor digiti minimi along with the insertion of the flexor digiti minimi. In very few individuals there is presence of the flexor digiti minimi longus muscle, which is an anatomical variation. The flexor digiti minimi brevis originates from the hook of the hamate and would insert along with the abductor digiti minimi. Next we have the opponens digiti minimi. The opponens digiti minimi also originates from the hook of the hamate and it inserts on the medial aspect of the fifth metacarpal. Also the opponens digiti minimi would originate from the hook of the hamate along with the flexor digiti minimi and would insert on the medial aspect of the fifth metacarpal. Now as we know that the anterior aspect of the forearm comprises of 3 muscle groups, which are the superficial, the intermediate, and the deep. So within the deep group of the flexor compartment, we have the presence of the flexor digitorum profundus. So the reason why I mentioned regarding the flexor digitorum profundus here is because the lumbricals originate from the radial side of the tendon of the flexor digitorum profundus, which passes through the metacarpals and would insert on the radial side of the intermediate phalange. So we can say that the lumbricals originate from the lateral side or the radial side of the tendon of flexor digitorum profundus, while it inserts on the radial side or the lateral side of the extensor compartment. Next we will discuss about the other group of muscles. These are the Adductor Pollicis and the palmaris brevis. The Adductor Pollicis has origin from 2 heads, that is the oblique head and the transverse head. We will take a look at the image very soon of the Adductor Pollicis, but for now we will take a look at its origin. The oblique head originates from the capitate and the base of the second and the third metacarpal bone. So here we have the Adductor Pollicis muscle. Also it takes its origin from the palmar aspect, to which we will take a look very soon. Also, the transverse head of the Adductor Pollicis takes its origin from the palmar aspect of the third metacarpal bone. Next, we have the palmaris brevis muscle. The palmaris brevis is responsible for tightening the aponeurosis while maintaining the firm grip while holding any object. So, the palmaris brevis is the only muscle to be supplied via the superficial branch of the ulnar nerve. So, it originates from the medial aspect of the flexor retinaculum and would insert on the skin of the medial side of the palm. The rest origination point are for the palmar introssei muscles, which are mostly 4 in number but could also be sometimes 3. So the palmar introssei are unipinnate muscle and originates from the medial aspect, which means the ulnar aspect of the 2nd to 5th metacarpal bone. So here we have the origination for the second palmar introssei muscle. The first palmar introssei muscle originates from the medial side of the thumb, and similarly for all muscles we can say that we have muscles for all digits of hand except the middle finger, which does not have the presence of the palmar introssei muscle, whereas the thumb, the index finger, the ring finger and the little finger have the origin points for the palmar introssei, which are, please correct a mistake here, that we have the insertion point for the opponent's digiti minimi from the medial aspect, and here we have the origination of the fourth palmar introssei muscle. An easy way to remember the function of the palmar introssei is by the mnemonic PAD-DAB, where P stands for palmar and AD stands for adduction and D stands for dorsal and AB stands for abduction. Apart from it, the function of the introssei muscle is to flex the metacarpophalangeal joint, which is present here, and the extension of the interphalangeal joint, which is present between the phalanges. Now let us discuss the nerve supply of the muscles of the hand. Almost all muscles of the hand are supplied by the ulnar nerve except the thinner group of muscles, which are innervated by the median nerve and the lateral two lumbricals, which is present between the second and the third digit. And note that the palmaris brevis is the only muscle which is supplied by the superficial branch of the ulnar nerve, while rest all muscles are supplied by the deep branch of the ulnar nerve. Even the adductor pollicis is supplied by the deep branch of the ulnar nerve. Now let us move towards the dorsal aspect of the hand. On the dorsal aspect of the hand, we have the main origination points of the dorsal introssei muscle, and as we have discussed earlier, we have the insertion for the lumbricals, and here we have the dorsal introssei. Now here we can take a look at the illustration which represents all the muscles of the hand. So here too I would highlight the subgroups in different color. We have the thinner group, which is highlighted in the pink color. Next we have the other muscle group highlighted in yellow color. The palmaris brevis muscle is present over here, which originates from the transverse metacarpal ligament, also known as the flexor retinaculum, which is present here. The next muscle group which we have is the hypothenar muscle group. Next we have the lumbricals, and lastly we have the introssei muscle, which are the palmar introssei and the dorsal introssei. You can note here that the lumbricals are taking its origin from the radial aspect of the tendon of flexor digitorum profundus. An easy way to remember all the thenar and hypothenar muscles is by the mnemonic is all for one and one for all. Here, starting from the ulnar aspect to the radial aspect, we have the abductor digiti minimi, then we have the flexor digiti minimi, next we have the opponent's digiti minimi, next we have the adductor pollicis brevis, next we have the opponent's pollicis, then the flexor pollicis, and lastly the abductor pollicis. And apart from it, we have only 3 muscle groups which are left, which are easy to remember, that are the lumbricals, the palmar introssei and the dorsal introssei. Now let's take a look at the boundaries of the wrist joint. There are 4 principal pillars which are responsible for the movements occurring at the wrist joint. So the first pillar is formed by the flexor carpi radialis, the second is formed by the flexor carpi ulnaris, the third is formed by both the extensor carpi radialis longus and the extensor carpi radialis brevis, and the fourth pillar is formed by the extensor carpi ulnaris. Here we can take a look that since the first pillar is formed by the flexor carpi radialis, it would be present on the anterior aspect of the forearm. So it is present here, that is closer to the thumb. Next we have the second pillar, which is formed by the flexor carpi ulnaris, which would be present near to the little finger. Third we have the extensor carpi radialis longus and the extensor carpi radialis brevis. The tendon of these muscles would form the boundaries of the anatomical snuff box, which we will discuss in further upcoming videos. And lastly, we have the extensor carpi ulnaris, which is also present on the posterior aspect of the forearm towards the little finger. Thank you for watching the video. If you like the video, please like, share and subscribe. And if you want such medical related content, do follow us on Instagram @Mediplaceboo. Thank you.